Good morning. I'm Don Walker, and I'm Communications Director for Brevard County Government. We are back after a short hiatus to provide our residents with an update on the COVID-19 pandemic. We started holding these on a weekly basis during the late winter and early spring of this past year. And as the numbers declined, we ran out of information to provide because things weren't happening as quickly as they had been. But unfortunately, those numbers have ticked up dramatically, and we decided that it was time to come back and answer some questions because we know there's a lot of misinformation out there, and we would like to do our due diligence to provide the right information to our residents. So we have a panel today that includes John Davis, who is the Community Health Director for FDOH Brevard. We have our Emergency Management Director, John Scott, our Brevard County Fire Rescue Chief, Mark Schomeyer, Public Safety Director, Matt Wallace. We have Catherine Allen, who is the Senior Coordinator with Brevard Public Schools. And we're fortunate today to have District 1 County Commissioner Rita Pritchett, who is the Chair of the Council. And she's here today to help talk to our residents and her constituents throughout the county about the COVID-19. So we will now turn it over to John Davis with Florida Department of Health Brevard for the latest update on COVID numbers. John?
Yeah, thank you, Don. So I'm just going to go over some numbers to give everyone a idea of where we're at right now and provide some perspective to that when we compare it to where we were really just a few short months ago in late May as well as this time last year. So where we're at now with positivity rate, we're at 22%, and really since the beginning of July, we've been averaging about 20% positivity rate. Sometimes a better metric to look at is the rate per 100,000. So that's cases per 100,000 of population. And unfortunately, right now, with the numbers that are going to be coming out today, we're looking at a little over 600 cases per 100,000. To put that in perspective, at the end of the school year, so in late May, we were looking at a little bit less than 50 per 100,000, a positivity rate of 4%. In August of last year, right before school was starting, we were at a positivity rate averaging about 5 to 6%. Actually looked at the start of school last year, I believe it was August 6th, we had 55 cases that day. We've had a few days over the last 2 weeks where we've had over 700 cases in a day. Hospitalizations, and I know John Scott will probably get into more detail on what our hospitals are dealing with right now. But looking back at the end of May, again, at the end of the school year, they were averaging about 40 cases, and that was system-wide, the whole county, all hospitals. Right now, I believe there's over 400 COVID cases in our hospitals. And I think if anybody's been paying attention to the news, we understand that our health system is very stressed and maxed out right now. Long-term care facilities, we were hopeful at the beginning of the summer. There were days where we weren't seeing any cases among the residents, a few scattered cases among staff members. Now we're starting to see some small outbreaks happen again in our long-term care facilities throughout the county, so that's a bit concerning. Luckily, because of the higher vaccination rate in that older age group, they tend to do a little better. So we've seen less hospitalizations than we were at first, and certainly less deaths. And so thank God for that. And again, a lot of that's due to the high vaccination rate in that age group. So looking at what changed from where we were at last year to now, we're looking at a different variant. This is not the original strand of the virus. The Delta virus is highly transmissible, much more virulent. Folks that are infected have a much higher viral load than they did with the original strains and some of the early variants like the British variant we saw. So the higher viral load, of course, leads to a greater transmissibility. So where before we saw an average of 2 to 3 infections per case that they spread it to. We're now looking upwards of 7 to 8 to 9. And I think that's why you're seeing this reflected in the numbers of daily cases we're seeing. In terms of vaccination, we're certainly not where we want to be or where we hope to have been at this point. We're looking at, in our county, at 53% of the population vaccinated. When you look at the population of vaccine eligible folks, which would be 12 and over, that's 58% vaccinated of the age group of 12 and over. Looking at some of the breakdown of that, so I'm just going to read through some numbers here. So 65 and over, you're looking at about 80% vaccinated. Folks in their 50s, around 60%. Folks in their 30s and 40s, a little bit below 50%. Folks in their 20s, 40%. When we look at our school age kids that are vaccine eligible, so 12 to 14-year-olds, about 30% of our population in that age group, and 15 to 19-year-olds, 38%. So that's what we're looking at heading into school. So I'd be remiss if I didn't use this opportunity to, again, encourage everyone that's vaccine eligible to get a vaccine. It's widely available throughout our county. Certainly at the health department, we're providing vaccines. Our Vieira facility is offering the Moderna, Pfizer, and J&J vaccine. That's a Monday through Friday operation, 8 to 4. Our Melbourne clinic is offering the Pfizer vaccine Monday through Friday, 8 to 4. Our Titusville clinic is offering the Pfizer vaccine Monday through Friday, 8 to 4. And certainly there's many other organizations throughout the county where the vaccine could be gotten as well. And in terms of deaths, we haven't seen a huge increase, again, thankfully, with this spike. So I'm hopeful that'll hold. A lot of that has to do with the vaccine. In terms of where we are we spiking yet? Can't say. Essentially, since I believe it was June 21st, we've doubled in cases each week. Fortunately, this last week that just passed, that's not the case. I wouldn't call it a plateau, but we certainly have not come close to doubling, so that's a hopeful sign. So again, we'll just continue to monitor the data. Thanks.
John, thank you very much for that. And John did mention hospitals, and I know our emergency management department is working very closely with our health partners in the community, and I will turn it over to John Scott for an update on emergency management. John.
Thank you, Don, and good morning, everyone. Again, my name is John Scott. I'm the Emergency Management Director, and just building on what John said a moment ago, I want to talk about where our hospital systems are in the county. All 3 hospital systems, as we've been talking about now for a couple weeks, are over capacity. They continue to have to deal with the surge that they're experiencing. It's a fairly strong surge for them at this point. They've implemented their medical surge plans at each one of their facilities. They're continuing to convert regular spaces into COVID spaces, into negative pressure rooms, so that they can accommodate those folks. And we are really seeing the cascading effects of what that does. I know Chief Schulmeyer is going to talk about what that is doing to the 911 system and the EMS folks. But I really want to emphasize, as we go forward with this, and we're seeing that surge in our hospital system, the importance that our hospital system plays in our overall healthcare system in this community, because as we surge there, it has cascading effects. People still fall down and break their legs. People still get in accidents. People still cut their arms. People still, unfortunately, have heart attacks. All of those kinds of things that require immediate medical attention are still occurring. And they're encountering long waits at our emergency rooms, trying to get through those kinds of things. It's why it's really important that we as community members in Brevard band together and really increase our vigilance and return to what we know helps slow the spread when it comes to COVID, which is face coverings, which is good hand hygiene, which is social distancing when possible, And of course, we know we have a solution to this, which is our vaccine. So encouraging folks to get as much good information out there on vaccines and making sure that they know where to get them. John talked about what the health department is doing to get vaccines out there. So too are our pharmacies, our primary care folks, and our urgent care centers. There is a lot of availability out there. In most cases, it's a walk-in. There's not a line for those kinds of things. So please take those opportunities. And then when you're out in the public, continue to do those good mitigation measures that we have proven worked during our experience with this pandemic. It is imperative that we pull together, and we get through this, that we slow this surge, that we help relieve the stress on our hospital system and our healthcare system so we can take care of everyone who gets sick. So that's what we're looking for, Don.
All right, thank you, John. From a county standpoint, obviously, too, we have our frontline, on the front line of that response to the pandemic is Brevard County Fire Rescue, and I will turn it over to Chief Mark Schillmeyer for an update from Fire Rescue. Mark.
Thanks, Don. So looking at the overall health of our department in general, out of our 450 field employees, we currently have 3 employees in quarantine and 10 in isolation. So those numbers will ebb and flow as this pandemic either increases or decreases, and so we expect to see those kinds of numbers. We have been seeing an increase in COVID positive and COVID symptomatic patients over the last several weeks. These numbers are equal to, if not greater than, we had at the height of the pandemic in 2020. Subsequently, our BCFR ambulances are seeing increased at hospital times due to the not being able to turn patients over to the hospital staff and causing those units to do what we call hold the wall for hours on several occasions. We continue to ask that people use 911 sparingly for non-emergent issues and to save the ambulances and ER trips for those that urgently need those services. Just being COVID positive but asymptomatic does not always make it a life-threatening emergent condition requiring a trip to the ER. We ask that people use a little bit of common sense and take advantage of your primary care physician, telemedicine, or an urgent care, and leave the emergency rooms and ambulance trips for those with life-threatening or serious emergencies.
Okay, very good information. I'm going to turn it over to Catherine Allen now, who's here for Brevard Public Schools for an update. We have school starting soon, and Catherine, what you got going on with BPS?
Thank you, Don. Again, my name is Catherine Allen, Senior Coordinator for Brevard Public Schools. Obviously, there's a lot of concern, and understandably so, for children starting the school year. What I'd like for our community and our families to know is we still have several mitigation strategies in practice. I know that the big hot topic right now is a mask mandate is not currently in place at this moment. It's voluntary, and that was made as a decision by our school board at the end of last school year. We will be discussing masks again at the school board meeting on Tuesday, August 10th at this time. Masks are still voluntary. We are obviously encouraging any students or staff members who wish to wear a mask. They're obviously very welcome in our schools, and we want our parents to know that we are still using plexiglass. We still have PPE. We still have all of the same protocols in place that we had last year in terms of hygiene and making sure that we're adding extra lunch periods, putting space wherever we can. So it's very important for parents to understand that we do have processes in place. We have updated our quarantine procedures. Obviously now we have people that have vaccinated status or somebody who has recovered from COVID. And all of that information is available on our resource information page. It's brevardschools.org/COVID-19. We really encourage our parents, our family, our faculty to go in and review all of the different mitigation strategies that we currently have in place. We know that you still have questions. Please understand we are doing all we can to work through a terribly difficult situation, and we're just asking for flexibility and patience, the same as what we had last year. This is something that we've never dealt with before, and we are working very hard constantly to make sure that we're keeping our students and our staff and their health and their safety at the top of our priority list.
Thank you, Catherine. We know the ripple effects of COVID-19 is very taxing on our community, and we're sensitive to the fact that this has put a tremendous burden on our residents. And since the first wave of this pandemic, our Board of County Commissioners has been earmarking millions of dollars toward rental and utility assistance, for residents in need. They've also done small business loans. They've done other things for their community, such as providing dollars for hospitals. I wanted to mention briefly our Housing and Human Services Department does have a rental and utility assistance program underway. It's been underway for several months. So far, we've received about 1,300 applications for rental assistance. We've approved nearly 1,000 of those. Those applications are available on the county website at www.brevardfl.gov. And if you'll go to Housing and Human Services, there is an application for rental assistance. One of the primary reasons some of the applications have not been approved is because people are either not completing those applications in full, or we've done follow-ups where we've requested additional information and then received no response. We've also done, we spent over $3 million on rental and utility assistance. We still have $12 million in rental and utility assistance available, so there's plenty of money there if you are in need and need assistance. And we're averaging roughly $4,500 per household that's requested money. So I just wanted to get that word out there. And we also have money from the federal government that has been earmarked for all of the county through the commission districts. And with that, I'm going to turn it over to Commissioner Chair Rita Pritchett. Rita, we've heard some sobering numbers today. What can you tell us from a commission standpoint?
I can tell you I'm thankful that we have you guys that know what you're doing to help bring us some data and to be so busy taking care of the community. I would like to take just a few minutes, though, and encourage people to maybe consider to go ahead and get a vaccine. If you've been thinking about it, it might be good timing to do it. You know, even if you did it now with this upsurge that we have right now, within a few days it does something. I know it takes a while for it fully to kick in to do what we hope it would do, but it does help a little bit alleviate part of it. So let me encourage you, first of all, if you're considering it, maybe consider doing that now. If not, I just want to really encourage you, if you just can't do it, and I mean, I get it, some people just can't, make sure you're washing your hands, you know, social distance, you want to eat healthy, spend some time outside, exercise. If you're sick, please stay home. And, you know, do your best not to get fearful or get weighed down, because that just really takes havoc on your immune system as well. So, you know, I know it's tough with all this going on, and we've never had to deal with this kind of thing before, Dawn. I mean, we're 1.5 years into it, and it still, to me, just boggles me how we're getting through this. And I'm impressed how well we're getting through it. But I know it's tough, and I know with the new upsurge, it's a little bit more difficult. And I thank you guys for your data, and I heard you talking about places to get tested. I've had some members of my family just recently go to Walgreens, were able to walk right in, get the vaccine, and walk right out. I heard that some stores are giving $10 gift cards to do it as well, so you might want to shop that. I do want to mention, too, if you're needing a COVID test, I know some of these MedFast lines, guys, are like hours long, but if you go into the CVS and Walgreens, you can pick up an at-home $15, and they're pretty accurate. And you go home and test yourself and see what it is you're dealing with. And if you've got it, I love some of the information you guys have been giving as far as hospitals. You know, they're overwhelmed. But, you know, if you're really, really sick, definitely go to the hospital. Our goal is to keep everybody alive through this. But, you know, someone just kind of introduced me to the online doctor recently, where there's this little app on your phone, and you can do that and get a doctor online, and they can kind of talk you through things and tell you how to care for yourself and your family. So I wanted to mention a couple of these items out here that will help you tremendously get through some things and help you with some maybe alternative ideas. You know, I do want to send out a big thank you right now to the hospitals and to the schools and to all of you guys as first responders for doing this job and this work. You know, the main thing that we're trying to do is keep our community alive and keep them healthy and help get everybody through this, because at the end of this, you know, we're going to be the greatest nation on the world, and this is the greatest county in the whole state. So we're going to get back there again. So I just want to remind everybody that we're all going through this together as a community, and I love this community. I love this county. And we just have to remember that we're just all people here living together, working together, and we need to really make sure we're caring for one another. And the skill board will appreciate this, and just stay kind with each other as we're working through this process. And I can't thank this community enough for what they've done so far in helping each other. And you know, I've heard of people, you know, dropping food off at people's house with COVID and checking in on them. And so I just want to mention that I appreciate that so much. But I do want to say this. I work in a church. That's my real life. And we have a daycare there. And we had a 75% infection rate with the daycare workers. Every one of them that got the COVID were unvaccinated. The ones that were left, the 25%, had all had their vaccine. And we didn't have hardly any of the kids get it. We had a couple. So we still had all the children, and we had to really get creative with, you know, sending the kids home in quarantine and taking care of the ones that were still there. But that's another reason. I just want to really encourage you to get the vaccine. It really is making a difference. But again, if you're just too nervous to do it, and I get it, you know, do what you need to do to take care of yourself as far as staying away from people who are sick. But correct me on this, but I think I'm right on this. We talked about this the other night, Dawn. Isn't Pfizer about to be FDA approved here pretty soon?
Yes.
John could probably
Thank
answer
you.
that.
They're looking at potentially by the end of this month.
Wonderful. And that is just the Pfizer one so far they're working on, or?
So I would imagine Moderna would be close behind.
Okay.
And I know certainly the Department of Defense is looking at, making it mandatory as well. So more people and organizations are certainly
The
moving in
FDA.
that direction.
Yeah. Thank you.
Thank you, Commissioner. When I introduced the panel today, I failed to introduce Jessie Ray, who is the county social media specialist, and she has been monitoring your comments on Facebook Live and is calling questions from those comments to ask our panel. So we will entertain some of those starting now. Jessie?
Thanks, Don. Appreciate it. So like Don said, I've been looking at the questions as we've gone along here. Very quickly, just wanted to answer a couple things myself as far as why some of us are not wearing masks. As we've talked about, it is a bit of a choice, but most of us here in this room are vaccinated, and we are very social distance right now. And with the deaf and hard of hearing community, we want to make sure that they can kind of read our lips, since we do not have an interpreter and we do not have captions up here today. So it makes it very difficult for that community to get the information if they cannot see our faces. So that's why some of us have made the choice that we made. So getting to the questions. For the health department, how concerned are you about public schools reopening next week with full classrooms, no option for distance learning, and no face covering requirements? And what is your advice to parents about what they should do to protect their children returning to the classroom?
Well, certainly we're very concerned. Again, in pointing out these numbers, as I did earlier, we're facing a lot different situation right now than we were at the beginning of last school year. We have a tremendous amount of disease in this community right now. We're saturated, and so are all the surrounding communities and counties. So yes, we're very concerned with students returning. I have 2 children myself in the public school system, and I've certainly been dealing with it over the last year personally. Again, I would encourage vaccination for those that are age eligible. And again, I just can't stress enough that one of the things we see over and over again, not only in the schools, but in the work environment and in the long-term care facilities and regular offices around the community, and I think Commissioner Pritchett had mentioned it earlier, is if you're not feeling well and you're sick, don't go to work, don't go to school. I know that's part of our culture to just push through, and we all probably grew up that way, and you just kind of tough it out and show up anyway and hope you get better. But in this kind of environment, we need to drop that. If you're not feeling well, please do not go to school, do not go to work. We see it over and over and over again where we have folks that feel a little under the weather, show up to work or school, and then you start seeing the spread. So just wanted to put that out there. Again, one of the hard things about COVID is it mimics so many other things. So a lot of what you see could look like a simple allergy, like an environmental allergy, but these are some of the same symptoms that occur when you're infected with COVID. So I realize it's difficult, but again, you have to make that choice to avoid potentially infecting others.
Awesome. Thank you.
Jesse?
So actually on that, Catherine, is e-learning going to be an option for school next year?
So e-learning is not an option. It was not approved through the Florida Department of Education. It's not something that was a sustainable model. It was intended for last year to obviously give families more choice. Now, we understand that a lot of families do want a virtual option. We've actually, at the recommendation of Dr. Mullins, our superintendent, reopened the application window for Brevard Virtual School. It is a full-time option. There are also flex options available. So that window is open until 11:59 p.m. tonight. So you can get that information at brevardschools.org, navigate to schools, and then click on Brevard Virtual. There's a lot of video tutorials, there's a lot of FAQs that can answer a lot of questions for you. And certainly if a virtual option is what you're looking for, there are options for our parents. So we understand that e-learning was convenient. It was never going to be a sustainable model, though, for our teachers in the classroom. And unfortunately, we did see a lot of abuse just in terms of students just not showing up to class. So it definitely is something that we're encouraging Brevard Virtual School as the virtual option for those parents who don't wish to have brick and mortar classes.
Awesome. Thank you. Commissioner, I have one for you. The Department of Health described Brevard County's rate of COVID cases as off the scale. So why does the county commission, or why doesn't the county commission do anything to push for mask requirements and vaccinations, either for county employees or for the general public?
Well, the county commission has encouraged it, and we continue to do that. I think we just gave some financial encouragement if staff would do that as well. They're going to get I think $1,000 extra to go get a vaccine. Mm-hmm. And as far as masks, we do encourage that. And private businesses, they can do it, but as far as a government mandating what a person does, it can get to be quite a situation because you always want mandated the things you don't mind doing, right, but you don't want to mandate the things you don't. When we did the mask, I had a big group that, mandate these masks, and I said, well, if I get the vaccine, do you want to mandate that? And they're like, well, no. So, you have to weigh that. But again, here's the thing, and there's people really afraid of the vaccine, and I'm not going to force it on them. I get it, it's going in their person. But if they are really, really afraid of it, then they need to take extra steps to keep them healthy because they're more vulnerable to this virus going around. And you know what? This virus isn't nice. It's really painful. When I first, we had this going on last December, a lot of my family members and people that I'm very, very close to got COVID all at the same time. And I watched them go through it. As soon as the vaccine came out, I knew I was getting one. Because this is not a nice virus, and I hope I answered that, ma'am.
Got it. Thank you so much. I appreciate it. So, we talked a little bit about those who are afraid to get vaccinated, at least until it's FDA approved, and those who maybe can't because they're allergic to it or the ingredients that are in it. What are some other treatments or therapies or things that people can do or consider who can't or don't get vaccinated? I'll give that to either John.
Yeah, it sounds like FDOH question.
Well, again, assuming somebody's not symptomatic, it would be self-monitoring. Again, in terms of who can't get the vaccine, very few people would fall into that category. I mean, obviously, the age issue, but
right,
if you're 12 or over, very few people would be it would be contraindicated in. You're talking about more chemical type allergic reactions to the components like glycol or cholesterol, lipids that are in the vaccine. So that's highly unlikely. So that's a very, very, very small percentage of the population that would be excluded from getting the vaccine, assuming they're 12 or over. So again, it would be self-monitoring for symptoms, certainly using mitigation strategies that we know work, social distancing, masking, cleanliness, changing air filters out, upgrades of air systems in offices with tight spaces and high amount of workers and whatnot. So these are things that should continue to happen. Again, we know they work for a reason, and I would encourage people to continue to follow those mitigation strategies.
Okay, excellent. Thank you. I've got time for just a few more. So tests. John Scott, I'm probably going to pass this over to you. I know there are a lot of people who are trying to get tested as the COVID numbers go up, and they're seeing that they go and where they're going are out of tests. Where can people get tested?
Thanks, Jesse. So we talk about testing. It is still widely available in our community, but like anything, as numbers go up, so too does the demand for testing. So where maybe we got a little accustomed to the idea that it was pretty easy to get a test, it was 10 minutes, 5 minutes, in and out, we're not in that situation anymore. Again, volume of folks who are actually sick in our community is up. That also means the volume of folks interested in getting tested is up. So that goes up correspondingly. We know that it's available at urgent care centers, Walgreens, CVS. Commissioner Pritchard talked about the fact that there are some at-home versions for folks. You can continue to do that. A lot of primary care physicians are also offering it. We always encourage folks to go to their primary physician anytime they have a question about their health. But I also want to caution folks, just because you want a COVID test doesn't mean you should go to the emergency room. In fact, that's the exact opposite of what you should be doing. And go to Walgreens, go to CVS, contact your primary care physician, or go to an urgent care center. But also, we got to be patient. We are working with suppliers. Tests continue to come in, but the demand is up.
Understandable. Thank you. Just a couple more. How many pediatric patients are currently hospitalized in Brevard County, or are we transferring them to the pediatric hospitals that are in Orlando and Orange County? John Scott? John?
I'll take it.
Okay.
Thanks, Jesse. So fortunately, we're still seeing a very low number of pediatric hospitalizations, which is great news. But we are seeing an increase. Now, when I talk about an increase, we went from 0 to, half dozen, and it sort of goes up and down. We know that it continues to, kids remain vulnerable to it, and we've got to continue to work to protect all of our community, and especially our children. We are keeping them, for the most part, in our hospitals, in our hospital systems, but if there is a need, they do transport out, and that's made on a medical decision basis. But it's a thing.
Okay.
I would echo that. We haven't seen a huge increase in hospitalizations of children. There are some in our hospitals right now, not an alarming rate. Again, thank God. However, I think the bigger thing to consider too is not just looking at how much of this age group is in the hospital. Again, this is a community-wide problem, so we have to look at it as how does this affect the community as a whole? So even though somebody may not be getting hospitalized, they can certainly transmit it. Awesome. So, they're bringing it home, and then maybe mom or grandma or dad gets it, that then ends up in the hospital. And that's what we're seeing right now, and that's what's stressing the system. Mm-hmm. So you also have to consider that fact as well. Hospitalizations, yes, it's something to look at. But again, there's plenty of people out there that obviously have it that aren't needing hospitalization, that may in fact be asymptomatic, but they're spreading it to folks that may be more vulnerable due to comorbidities and certain medical conditions and whatnot.
Understandable. So I only have time for one more question. I know we have a lot of questions, but like Don said at the beginning of this, we will be doing this on a weekly basis. So feel free to join us again next week. So our last question for today: are we seeing deaths from the vaccine, from people who are getting the vaccine? Are we seeing deaths from that?
No.
No. Okay. That's all I have for today, Don. Thank you.
Okay, and Jesse stole my thunder a little bit. I was going to say that we know that there is a need to get information out into our community, and we know that there is a lot of misinformation that's out there. And so our plan is to continue holding these Facebook Live events for the coming Fridays, each Friday at 11:30 until further notice. And we will have other panelists like we have today, and I appreciate everyone being here today. And before we close off, I'm just going to say that we always recommend that people follow the CDC recommendations. That's social distancing, wearing facial coverings, practicing good hygiene and keeping your hands washed, and then getting vaccinated if you can. So thank you for joining us today, and we will see you next Friday.